Welcome to Pharma Hotspot guys, and in this lecture we discuss some important points of the chapter antimicrobial drugs which is present in KD Tripathi. So some very important points we discussed, or you can say this is the overview of the chapter. So first we discuss about introduction of antimicrobial drugs. Then we discuss about history of antimicrobial drugs, then the classification, and after that problems that generally occurred when we take antimicrobial drugs. After that, how we choose and right antimicrobial for particular patient, like in pregnancy, which antimicrobial we have to take, or we have to stop antimicrobial. So all this kind of stuff we discuss in the choice of antimicrobial. After that, combinational antimicrobial, like we give the antimicrobial with the 2 or 3 drugs simultaneously. So the problems that occurred or what are the advantages, that we also discussed in the last of our video. So these are the basically 6 points that we covered today. So let's begin the video. First of all guys, introduction. So generally we treat systemic infection with specific drugs that selectively suppress the infecting microorganisms without significantly affecting the host. So guys, we have to treat the systemic infection, okay, and in such a way that the host, which is the patient's body, is not affect, and the organisms which produce such kind of infection get killed. So these type of drugs we use that kill only microorganisms, not the host cell. After that we have antibiotics, which are the substance produced by microorganisms which selectively suppress the growth or kill other microorganisms at low concentration. So antibiotics is the product which is secreted by the microorganisms. If you see the biotics mean living organisms. So they kill the microorganisms at low concentration. So antibiotics is generally for bacteria, but antimicrobials, okay, they suppress the growth of microorganisms like bacteria, fungi, protozoa, and virus. So antibiotics are come under the antimicrobials. Okay, if we see the history, then we have to just go back in the 1935. So in 1935, Domek is doing some experiment on Prontosil. Prontosil is basically a sulfonamide dye in a pyrogenic infection. So the Domek just experiment on a pyrogenic infection, how to treat it with Prontosil. What he was found that he found the active moiety was para-aminobenzoic sulfonamide. So from para-aminobenzoic sulfonamide, they discover the sulfopyridine, which is the first sulfonamide to be marketed in 1938. So it took 3 years to market the sulfopyridine, and this is the first sulfonamide. After that, in 1929, the Fleming, you heard about that. The Fleming found penicillin. How is found that? He just found a substance which destroy streptococcus, which is a bacteria present on culture plate of penicillium mold. So The Fleming just found a substance which destroy the bacteria named as Streptococcus, which is present on culture plate of Penicillium mold. He named this substance as penicillin, and after that, Chen and Flore follow up this observation in 1939. So after 10 years, the Fleming's experiment is continued by Chen and Flore, and he observed the clinical use of penicillin. And as you know that penicillin was help in World War II by treating the wounds, and also the commercial manufacturing was started very soon. Okay, so this is the history of the antimicrobials, how the first sulfonamide is marketed and how the penicillin is discovered. After that we have the six classification to which the antimicrobials are divided. The first classification is by chemical nature. So as you see in the table, there are different category which is divided according to chemical nature, and after that we have some drugs like sulfonamide, we have sulfadiazine, dapsone, para-aminosalicylic acid. After that we have diaminopyridines, in which we have trimethoprim and pyrimethamine. Quinolones, we have nalidixic acid, norfloxacin, chlorofloxacin, beta-lactam antibiotics, in which we have penicillin, cephalosporin, monobactams, carbines, tetracycline, we have oxytetracyclines and deoxycyclines. In nitrobenzene derivatives, we have only chloramphenicol. In aminoglycoside, we have streptomycin, gentamicin, and neomycin. In macrolide antibiotics, we have erythromycin, clarithromycin, and azithromycin. So these are some classes that are divided according to chemical structures. Second, we have classification according to mechanism of action, how the drugs act. So first category we have inhibit cell wall synthesis. So we have to kill the virus or bacteria which create infection. So what the penicillin, cephalosporin, cycloserine, vancomycin, and bacitracin do, they simply inhibit the cell wall synthesis of these viruses. Okay, so these drugs just inhibit cell wall synthesis. After that, these drugs which are polypeptides, we have in polypeptides we have polymyxins, colistins, and in polyenes we have amphotericin B, nystatin, and hemicin. So these cause leakage from cell membrane. Okay, tetracycline, chloramphenicol, erythromycin, clindamycin, linezolid, they inhibit protein synthesis, and like in the same way we categorize various drugs according to their mechanism of action. Like these fluoroquinones inhibit DNA gyrase, aminoglycosides, which is very important, they misread the mRNA code and affect permeability. They inhibit with the DNA synthesis, they interfere with the intermediary metabolism, okay, and they inhibit with the DNA function. Okay, so we just move to a third classification, which is types of organisms on which they act upon. So this is basically the viruses, like the infecting, you can say, bacteria or fungi, which category if they are, like if it is bacteria, which create infection, then it's come under the category of antibacterial. And for that we have drugs like penicillin, streptomycin, aminoglycosides. For antifungal we have grisophulvin, which is very widely used, aminotericin B, and ketoconazole, which is also the very popular drug nowadays. And in antivirals we have acyclovir, amantadine, and zidovudine. In antiprotozoal we have chloroquine, myrimethamine, metronidazole, and diloxidine. And antihelmintic we have mebendazole, pyrantel, niclosamide, and diethyl carbamine. So you have to just don't learn it, but just go through that all the 6 tables, so that you have an idea that which drug is belongs to which class. So for GPAT point of view, you have to just go through the tables. Okay, so after the type of organisms, we have the spectrum of activity. Like if they are narrow spectrum, means if the drug share is used in particular area, in particular range, then this is narrow spectrum. And if the drugs are used widely or for many diseases, then these are come under the broad spectrum. So for the narrow spectrum, in which the drugs are used for the single disease or very few disease, then we have penicillin G, streptomycin, and erythromycin. But in the broad spectrum we have tetracyclines, okay, and we have chloramphenicol. After that we have types of action. So if the drugs are bacteriostatic, so what are bacteriostatic? Bacteriostatic, as the name indicate, that bacterio mean bacteria and static mean which are not in the motion, which are stable, which are stopped at one position. So bacteriostatic drugs are simply don't kill the organisms, but they just inhibit the growth. If the number of bacteria is 6, then it remains 6, and they don't kill it. But in bactericidal, they kill the infecting cell. Okay, so bacteriostatic just suppress the growth, but bactericidal kill the organisms. So this is the major difference. So in the bacteriostatic we have sulfonamide, tetracyclines, chloramphenicol, erythromycin, ethambutol, clindamycin, and linezolid. But in bactericidal we have penicillin, aminoglycosides, polypeptide, rifampicin, chlorotrimazole, cephalosporin, vancomycin, ciprofloxacin, and metronidazole. So these are important. The direct question comes in the GPAT, that which of the following drugs are bacteriostatic, or you can say which of the following drugs are bactericidal. So you have 4 options, and you just have to pick the right correct one. Okay. After that, okay, why we have the bio source, so from which the drug is basically we get. So if we get the drug from fungi, then we have penicillin, grisophulvin, and cephalosporin. If the drugs come from bacteria, then this is polymyxin B, colistin, bacitracin, tyrosine, and azithromycin. Okay, so we discuss some problems that are generally arrived when we take antimicrobial drugs. First one is toxicity, like if someone give you injection, then at the site of injection we see some irritation or some kind of problem. So these are come under the local irritancy. So as you can see that you have to write in exam that this is exerted at site of administration, like irritation and abscess. Abscess is the pus, like white fluid is formed. Okay, formation at site of injection. Second is systemic toxicity, like kidney toxicity, which is very the major issue, and see after long period of time. You can't see instantly. Okay, like you take the drug, or you can just take the injection of antimicrobial and you see it. Like aminoglycosides create kidney toxicity, which lead to kidney damage. Okay, tetracyclines produce liver and kidney damage. Chloramphenicol produce bone marrow depression. Okay, the second problem we see is hypersensitivity reaction. So these are unpredictable and unrelated to dose. Super infections we also see, like urinary tract infections. We also see some nutritional deficiency in some patients, like if we take prolonged use, if we take the antimicrobials for the very long period of time, they result in vitamin deficiency. Okay, how we choose the correct antimicrobial drugs? First, we have to see the patient factors, like what is the age of patient. Below the age of 6 years, tetracycline accumulates in developing bones and teeth, which makes them so weak. So the children's which are below 6 years, we generally avoid tetracyclines. Okay. After that, drug allergy. So the some patients which have allergy with some particular drugs, so these drugs are avoided. And we gave some alternatives, like some patient have allergy with penicillin, so we avoid the penicillin with the erythromycin. After that, we have pregnancy factor, like all antimicrobial drugs are avoided in pregnancy because they produce risk to fetus. For example, if we give tetracycline to the pregnant lady, then it causes bone and teeth deformities in the fetus. Aminoglycosides cause ear deformities. Aminoglycosides penicillin G, carbapenems, cephalosporin and vancomycin are generally given by injections. So these drugs are need to be sterile and free from all kind of viruses and bacteria, because these directly inject into the blood. But if you don't want to take the risk of getting infection, then the oral route is preferred by the doctor. So because if you take orally, then the drug is going through by the HCl, by different kind of chemicals, by different kind of you can say digestive enzymes. So after that they reach to the blood, so the chances of getting infected is very less. But in the case of injections, you have to take so much precautions. Okay, so after last topic we have combination and antimicrobial drugs. So what are the advantages? Advantages are to achieve synergism. Synergism means to have the better result. So for the improvement, we have to combine the antimicrobial drugs to prevent emergence of resistance. So what's that mean is, if you take one drug for suppose 2-3 years, then your body are addictive to that and also resistant to that. Like if you take 500 mg paracetamol every day, then what gonna happen after 2-3 years? You have to increase the dose because your body get resist to 500 mg. They don't respond to that drug. And simply you can see the examples with the alcoholic people. Like initially they take 10-20 ml, after that they increase the dose to get same effect. Okay, so for to prevent that problem, we have to just combine 2-3 drugs so that our body can't resist to only one drug. To broaden the spectrum of antimicrobials, like you take penicillin as well as streptomycin, then the action is quite expand. Okay, it's because the penicillin act on different kind of bacterias, and the streptomycin act on different kind of organisms. So the action spectrum is also get expanded. So what are the disadvantages? The first disadvantage is the increase of adverse effect. If the dose is extended from the normal tolerated range, then it creates so big problem for us. Okay, so the adverse effect are also a major issue. Increase the risk of super infections like urinary tract infections and lung infections, or any kind of the organ damage is also increases. And the most important, we have the higher cost of therapy, because for the every patient we have to make the combination of specific drugs. For from patient to patient it differs. So for that we have to hire the expert team, and to hire the expert team, they charge very much, and that's why the therapy cost is gonna high. So that's all for today, guys. I hope you like the lecture and learn something new. And this is basically the overview of the chapter KD Tripathi. And if you like the video and also like the content, then press the like button. And if you are new here, join us by subscribing the channel. We will meet in our next video. And if you have any doubt, just put that in the comment section. We surely reply to that. Until then, take care and bye bye.